Let me shift to the 3D model, and let me give me a little overview. Then we will shift to the 3D models, and then we will review on this particular slide. Mandible, the jaw, this bone, the largest, strongest bone of the face. It consists of basically two parts and angle between them. This vertical part, the standing part, the one you feel here, this is the ramus. This horizontally lying part, this particular part is called body, and where they two meet, this point is called angle. After this, we will see the features that can be seen on the external aspect, the features that can be seen on the internal aspect, and along the margins. Let's move to the 3D model. Okay, then. Here is the skeleton of the head and neck. Let's isolate the mandible. We have selected the mandible, and let's remove all the other bones. So you are left with this mandible neat and clean. Mandible consists of two parts basically. This vertical part, this is called ramus. This horizontal part, the body, and the between them, here is the angle. Very simply, let me get my tools ready. Okay then. So ramus, body, and angle between them. So let's see the features. Let's move on to the ramus. In the ramus, there is the two processes on the top. There is the process here. This is called coronoid process. This is called condylar process. And in between them, this fossa. This is called mandibular notch. This notch is mandibular notch. This is called coronoid, and this is called condyloid. This is also called the head of the mandible also. And if you consider this the head, obviously the constricted part below it, this would be the neck of the mandible. Okay, this is the head and neck of the mandible. Let's look at the other features. If we see the other features, the external, it is roughly smooth. Here, this part near the angle, this part is rough. This part gets the attachments of the masseter muscle. I'm not talking about the attachments in the detail here. If you just place your finger here and clench your teeth, you can feel the muscle here, the masseter that help in chewing. It is attached here that gives the grooved area here. And then there is an interesting thing that is seen right here. This is the oblique line. This particular line is the oblique line. It is basically the continuation of the anterior border of the ramus. If you see from the front, the mandible, do you remember the origin of the mandible? The origin, you can mention in the comments. The origin of the mandible, what is the origin of the mandible? I'm leaving for you. Okay, the mandible was developed from the two sides and it met in the midline. So here, this point where the two points met in the midline, this is called symphysis. This is called symphysis menti, mentis, mandible ki symphysis mandible. And if you follow them down, there is this triangular raised portion. This is known as mental protuberance. The mental protuberance is more visible if you see from side to side. Here, this triangular process, this area, this is mandible prominence. And the upper margin of the mandible, it gives rise to the teeth. These are the alveolar arch. And you may be able to appreciate a little just below each of the teeth, there are fossa. You may see grooved areas just below the teeth. So these areas are incisive fossae. So this one, these are the incisive fossa. It, there are grooves just below the teeth, just as they were present in the maxilla. And then there is this opening. This is present in the mandible. This is called mental foramen. This is called mental foramen. And mental foramen, it from it the arteries and veins and nerves of the same name exit to the surface. Mental foramen. Okay. So these are the external features. I hope I have covered all of these. Coronoid process, condyloid process, neck, mandibular notch, ramus, angle, rough area, oblique line, mental protuberance, alveolar arch, incisive fossa, mental symphysis menti, and protuberance, mental protuberance. Let's look around the interior aspect. So, from the inner aspect, what can we see? Let me show you this particular thing right here. Just in behind the symphysis menti on the posterior aspect, there are raised tubercles. Usually, it is as a rough area. Otherwise, to be more specific, it's pair of raised areas, though two superior, two inferior. These are known as genial tubercles. These are known as genial tubercles. Mandibular mental tubercle name is also used for them. So these are genial tubercles. You will read the names of the muscles starting with the name genio, genioglossus, geniohyoid from this. Then there is this very interesting thing that is seen here. There is an opening right here. You can see this opening. This opening, I have to come here to show you the opening because this opening, it is protected by this bony projection. Let's talk about this bony projection first. This bony projection, this is called lingula. Lingula means tongue. It's tongue-like projection, lingula. And if you see from the lingula, if you see it is covering this foramen, this particular foramen, this is present in the ramus of the mandible. This is called mandibular foramen. It is present in the mandible. It is called mandibular foramen. Okay, and just beneath the mandibular foramen, you will be able to see this groove. This is called it. You will have to remember the name Mylohyoid. You will today in the today's lecture, inshallah, you will read about the muscle, mylohyoid muscle. So this is the groove for the nerve that goes and supply the mylohyoid muscle that is known as mylohyoid groove. Okay, and by the name of this muscle, there is another line that is visible here. It is not very much prominent in this particular section, but you can identify the line that is present here. This line. This is called, with the same muscle name, this is called mylohyoid line. So this actually gives rise to this muscle. Very important for telling you this line is that because the area on the top of this line, this area, it is making the floor. On the top of it there is tongue, so this area is below the tongue. Actually mylohyoid muscle, it's making the floor of the mouth. It is making floor of the mouth, or so this part, this fossa is above the floor of the mouth, this fossa is below the floor of the mouth. This is above the floor below the tongue, so it is below the tongue. This is called sublingual, and it is roughly mandible is just a little outwards. It is present a fossa below that. This is called submandibular. So these are the structures that are present for the that are present in the mandible. Okay, so I think we have covered most, if not all of them. Let's see if there is any more. So let's move back to the presentation. Okay, let's move back to the presentation. Let get a checklist if you have read or seen all of them. It is the largest and the strongest bone. It has ramus, body and angle, ramus, body and angle. External surfaces, you will be able to see symphysis menti, mental protuberance, mental foramen, oblique line, and incisive fossae. Singular will be fossa, multiple will be fossae, AE. If we see on the internal aspect, I'm moving from this picture to this picture, you will be able to see this line. There is an MCQ that mylohyoid line starts below the last molar tooth. It starts below the third molar tooth, so I have put it separately. It divides the interior surface into the sublingual fossa above and submandibular fossa below. In the midline, in the interior aspect, there are pair of two tubercles that are genial tubercles or mental tubercles, and mental spines or genial tubercles. And here is another fossa that I did not discuss there. If we follow the inferior margin here, just near the midline, this is the digastric fossa. This gives rise to attachment to the digastric muscle. So it is a little flattened as compared to the rest of the sharp border. So then in the ramus, on the upper aspect, we saw the coronoid process, condylar process, mandibular notch, neck of the mandibular, two fossa we left. There is a fossa just in front of the head, in front of the neck of the mandible, that is called pterygoid fovea, pterygoid fossa, and there is a fossa just in front of the ramus or behind the wisdom tooth or third molar. This is called retromolar fossa. These are two fossae. And one last thing that we did not discuss was the mandibular canal. So mandibular canal is basically the canal that is connecting which two structures? That is connecting the this mandibular foramen to the mental foramen outside. Mandibular foramen to the mental foramen outside. So if we look from inside, it would be something on this line. It would be something like, it will go like this. If we look from outside, it would be something like this. So this is the mandibular canal, and it actually, this canal does not stop at the mandible. It continues all the way below the teeth. So this canal is a very important that you must remember, because this canal, this canal, it runs and it carries all the structures that are necessary to supply the lower teeth, the mandibular arch. So it contains the inferior alveolar nerve and the artery and veins that is supplying and draining the lower teeth respectively. And a part of this nerve, a branch of this nerve gets out from this mental foramen to supply the area of the cheek. So this is about the mandible. Let me get to the point 0 and we will move to the next set of bones. So this is the mandible. This is we talked about. Let's move on.